Hi dears, I hope you are doing well. My research is about human hydatidosis. Human hydatidosis, a retrospective analysis in the Hock City Kurdistan region of Iraq. The first background or introduction to my research. The first, human hydatidosis is one of the important zoonotic infections that cause public health concerns among individuals. The present study aimed to study the epidemiological properties of hydatidosis infection in the Dahak Governorate's Kurdistan region of Iraq, which are shown in this image. Also, you can see the liver infection with hydatidosis. Methodology. The methodology of this research. In the current study, the total of 55 patients with hydatidosis infection were recorded from January 2025 to February 2026, and all patients' information was tabulated in tables. Result of this study. The first table of results, individuals' infection with hydatidosis, is in Dahok City, which are shown in these tables. We can see the gender, age groups, residence, and occupations. The first, gender. Regarding to the gender, the male and female infection with hydatidosis, 47%, 47.3% infection in male and 52%, 52.7% infection in female, which are shown here. As we can see, the infection of female with hydatidosis is slightly higher than in male. And also liver infections in female, 30%, 30.9%, and 27.3% in males. So the females infection of liver is higher than male. And also lung infections, 60.4% in female and 10.9% in male. Other organs, 5.5% in female and 9.1% of infection in male. And regarding to the age groups, in 1 to 15 in 15 age groups, it's about 32.7%, and in 16 to 30 age groups, 40% infection, which are shown in this slide or this table. We can see the infection rates of echinococcosis or hydatidosis is higher in second age group or 16 to 13 age groups, which is about 14%. And also 23.6% of liver infection in this group and 10.9% of lung infection, which higher than other organs infection in this age group. Regarding to residents, the urban and rural, or in the village or rural infection, it's about 60% and 40% in urban. So the rural infection with hydatidosis is higher than urban infection. And also in urban and rural, so we have liver infection in urban 23.6% and 34.5% in villages. And regarding to occupations, we have employed and student and unemployed infection, which are shown in these tables. We can see the unemployed patients persons are higher than other groups, which is 47.3 persons, which is higher than student and employed patient. Also, we have other table, the number of cysts, mode of diagnosis, and treatment. The first, the number of the cysts, the single cysts and multiple cysts. The multiple cysts, 40 pay, 25.5% and 74.5% the single cyst. So the single cysts which are shown here, the single cyst infection, single cyst in infected patients is higher than multiple cysts. And mode of diagnosis, so you have ultrasound diagnosis mode or method and other methods. The other methods, 56.4% and which is higher than ultrasound methodology or the method which is 43.6%. And also here we have the treatments methods. In treatment methods, we have surgicals and non-surgicals. The surgical methods is higher than non-surgical methods, which 83.6% is treatment is by surgicals and 60.4% with non-surgical or other treatments methods. Conclusion of this research. Hydatidosis infection is human, is public health concern. In this study which conducted in Dog City, the infection rate of female was slightly higher than that of the male. The recorded results showed the infections in liver, lung, and other organs, and the liver infections rate was higher than other organs. And also regarding to the age groups, the high prevalence of hydatidosis were recorded in 16 to 13 years age group, and the lower infection in more than 15 age group. Recommendations for this recommendation of this research. According to the study findings, the following points are recommended for future studies. The study rules of the stray dogs in transmission of parasite, which is very important, and study about the role of vegetable in transmission of infection, and also water sources. Study about different techniques in diagnosis of parasite, molecular characterizations studies about Echinococcus granulosus parasite and strain identification of this parasite. It's very important. And finally, we thanks all the Azari Teaching Hospital, Hivi Pediatric Teaching Hospital, and all private hospital in Dog City, and all the laboratory staff who help us in recording this data for this research. Thanks.